Good morning, Betty. Have a seat. My name is Dolly, and I'm the midwife attending to your visit today. Congratulations on your pregnancy.
Morning, Dolly. Thank you so much.
So, how have you been going with this pregnancy so far?
I've been going okay, just a little more tired as I'm further along now. I'm just a bit worried about when my baby's here and I don't know how I'm going to feed it.
So, in terms of that, can I ask, are you unsure of the method of feeding at birth?
I'm not quite sure yet. I don't know if I want to breast or formula feed this baby.
Would you like to discuss both options today?
I really want to know more on breastfeeding today, if you can please help me out, Dolly.
That's fine. Let's start with what you know about breastfeeding, Betty.
I don't really know much because I had a cesarean section with my first baby. I did not get a chance to breastfeed because of all the pain and drowsiness and I wasn't really keen on it.
Oh, that's really horrible that you weren't able to breastfeed. You must have been in a lot of pain. Be aware that you are able to request for pain relief when needed in the hospital, and the midwives are always happy to help you with breastfeeding. It is recommended that breastfeeding should be initiated within the first hour of birth and that the child should be exclusively breastfed for the first 6 months of life. Since you are intending to breastfeed, would you like to share what you know about the benefits of breastfeeding for your baby?
I know that it's a way to feed my baby and a good way to bond. I've been told by friends that breast milk is good for babies, but I'm not sure why. I think they mentioned something about good immunity. Also, do I have to stop breastfeeding at 6 months?
Yes, Betty, it is a way to feed your child and is essential to developing a bond with your baby. A hormone called oxytocin, or a love drug, is released by your body when breastfeeding, which helps to develop that stronger bond. You are also correct that breast milk is best for the baby's health as it contains antibodies that help fight the bacteria and essential nutrients to help with brain development and growth. You don't need to stop at 6 months. 6 months is the minimum recommendation of breastfeeding to yield the best outcomes for your baby. You can breastfeed up to 2 years.
Oh wow, I didn't know that breast milk could be that good for the baby. But I feel like if I breastfeed, my breasts are going to sag.
There are breast changes during pregnancy and while breastfeeding. Your breasts become larger, almost a cup size. Breastfeeding alone does not cause your breast to sag. There are other factors such as age, genetics, size and shape of your breasts, weight loss or weight gain, smoking, and having the right bra to support your breasts.
Oh, okay, I see now. I have to take good care of myself so it doesn't happen. I'm going to make sure that I eat well during this pregnancy and after birth. I don't smoke, however, I will try my best to stay away from people that do. And I will buy myself some good maternity bras that are comfortable and well supportive. So breastfeeding is good for my baby, but why is it good for me?
Breastfeeding is really beneficial for you, Betty, as it reduces the risk of many diseases such as breast and ovarian cancers, diabetes, high cholesterol and high blood pressure, helps with weight loss and reduces the likelihood of obesity. The love drug that is released while breastfeeding can also help with your mental health. Breastfeeding is also convenient for you and your partner as it is cost effective because breast milk is free. You don't have to buy formula, pay for equipment, and also save money on water and electricity bills.
Thank you so much, Dolly, for this very useful information. It was really helpful and I think I've gained more insight about breastfeeding. I think I'll give this a much needed thought, but I do want to breastfeed this baby.
Okay, since you are wanting to breastfeed, on the scale of 0 to 10, how confident are you now to breastfeed?
Honestly, I would say a 3 out of 10 because I have no experience and little knowledge, but I have gained some today on how to breastfeed, but I am keen on breastfeeding this baby.
Thank you, Betty, for your honesty. Would you like to set yourself some short and long-term goals on breastfeeding after birth?
Yeah, I think I would like to set a short-term goal of actually trying to breastfeed after birth, and I think my long-term goal would be to breastfeed for 6 months if I can.
That's really good, Betty. That's a good idea. I think my recommendation to help you with your short-term goal is to do skin-to-skin at birth with your baby and also try to breastfeed within the first hour of birth with the help of your midwife. For your long-term goals, I think it is amazing that you have decided to breastfeed for that long, and you can also continue to breastfeed for longer if you are comfortable.
Thank you, Dolly. Do you have any breastfeeding resources that I can use to help me get started?
Yes, our clinic can offer you breastfeeding classes, which you can attend in person or on Zoom at the comfort of your home. You can also watch videos on the Australian Breastfeeding Association or Acholthii website. Breastfeeding is completely your choice. You decide what you feel is best for you and your baby.
Thank you, Dolly, for your help today. I don't think I'm as anxious as I was before to breastfeed this baby.
You are most welcome. I greatly appreciate you opening up to me and participating in this visit. If you have any concerns about your pregnancy or baby's movement, please contact birthing unit. Do you have any concerns to raise or any questions you would want to ask me, Betty?
No, I think we have covered most of my concerns and questions today.
I hope to see you again at your next visit. Goodbye.
Goodbye.